Good afternoon, everyone. My name is Nirav Shah. I'm the director of Maine's Center for Disease Control and Prevention. I'm joined this afternoon by Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Commissioner Lambrew and I are here to provide everyone an update on all things COVID-19 that are going on for today, Monday, November 9th of 2020. I'll start by providing the public health update and then turning things over to Commissioner Lambrew. We begin today's briefing by reporting on 2 additional deaths that Maine CDC reported on and recorded this past Saturday. One was a man in his 70s from Somerset County. The other was a woman in her 80s, also from Somerset County. Collectively, their passings mark the 151st and 152nd deaths with COVID-19 across the state of Maine. We'd like to take a second to recognize their passing and to offer our deepest condolences to the friends, family, and communities of both of these individuals. May their memories live with their friends and families forever. Right now, statewide, there are a total of 7,897 cases of COVID-19, an increase of 204 cases just since yesterday. That marks our single largest one-day increase of cases since we began this work back in January of this year. Of those cases, 7,031 are confirmed, an increase of 188 confirmed cases, and 866 are probable, a rise of 16 probable cases. Among those, 6,020 have recovered, an increase of 85 recoveries. In terms of hospitalizations, 529 people have been hospitalized at some point. And just in the past 30 days, 60 people have been hospitalized with COVID-19. Right now in Maine, 49 people are currently hospitalized. 14 of whom are in the intensive care unit, 35 of whom are in non-intensive care unit beds, and 5 of whom are on ventilators. That amounts to a hospitalization rate right now in Maine of 3.65 hospitalizations for every 100,000 people. To put that number in a bit of perspective, the national hospitalization rate right now stands at 15 people for every 100,000 across the country. Just a few weeks ago in Maine, our hospitalization rate was 1 per 100,000, and today it stands at triple that at 3.65. As I mentioned a moment ago, there have been 152 deaths among individuals with COVID-19 since we began our activation, and overall, 1,278 of our cases are among healthcare workers. Just looking at the cases from yesterday, 31% of yesterday's cases were from Cumberland County, and 25% of yesterday's cases were among folks from Androscoggin County. Let's turn for some updates on outbreaks. I'd like to talk first about some new outbreak investigations that Maine CDC has opened recently. One is at Kids Peace in Ellsworth, where we are aware of 4 positive cases at that facility. Laboratory tests across that facility are outstanding right now, and we'll have more information about other potential cases, if any, as those laboratory results come in. We've also opened an investigation into the Pentecostals of Jonesport Church in Washington County, where we are aware of a total of 9 cases associated with that house of worship. We've also opened an investigation into Ruby's in York, a restaurant there, where there are a total of 9 cases, 6 of which have been identified amongst attendees or patrons of the restaurant, 3 of which have been identified among staff members. And finally, we've recently opened an investigation into the Portland Pie establishment in Windham after detecting 3 cases associated with Portland Pie there. Next, a few updates on some open outbreak investigations. At Russell Park in Lewiston, we are aware of now a total of 72 cases associated with that facility, 45 among residents and 27 among staff, one of which includes an outside vendor. On Saturday, the team at Maine CDC, as well as other agencies, had a productive call with Russell Park to make sure that they have everything they need from an infection control standpoint, from a PPE standpoint, as well as from a testing standpoint. There are 2 rounds of testing that are underway at Russell Park, one today and another tomorrow, after which point we'll have a better sense of how that outbreak has evolved within that facility. Also, at Durgan Pines in York County, we are currently aware of a total of 33 cases there at that facility. Similarly, we are working with Durgan Pines to make sure that they've got everything they need from a PPE perspective, an infection control perspective, as well as from a testing perspective. We'll have additional updates on both of those as additional data come in. And finally, a quick note on where things stand with respect to testing. Right now, our 7-day positivity rate for PCR tests in Maine stands at 2.14%. 2 weeks ago today, that rate was 0.66%. And thus, in one incubation period of COVID-19, the positivity rate in Maine has more than tripled from 0.66% to where it stands now, 2.14%. To put that number in perspective, the national positivity rate for PCR tests currently stands at 7% across the country. And finally, in terms of testing volume, our volume in Maine right now stands at 573 tests for every 100,000 people in Maine. The national average for testing volume is at 387 tests for every 100,000 people. And again, our rate in Maine stands at 573. So with that, I'd like to turn things over to Commissioner Lambrew.
Thank you, Dr. Shah. Today, the Mills administration is announcing the launch of 2 new mobile COVID-19 testing sites in Maine through a partnership with Promerica Health. The additional sites expand access to standard and rapid COVID-19 testing to people in Maine who think that they need a test regardless of symptoms and without the need for a referral from a healthcare provider. At a time of rising COVID-19 cases in Maine, these new testing sites are especially important in identifying and isolating people with this contagious and deadly disease. The new sites in Portland and Auburn expand our already robust testing capacity. We thank Promerica Health for helping to make this happen. Testing at the Portland International Jetport is available 7 days a week from 11:30 a.m. to 10:30 p.m. starting today. It is inside the terminal and accessible to both travelers and members of the public alike. This Friday, Promerica Health will begin offering mobile testing at the downtown Auburn Transportation Center. Appointments will be available 5 days a week from 9:30 a.m. to 4:30 p.m. Appointments at both sites can now be scheduled online at covidtestforme.com. That's covidtestforme.com. Promerica is providing standard PCR tests at the Jetport and Auburn sites for free under a swab and send agreement with the department. Additionally, Promerica Health will offer rapid Abbott Id Now COVID-19 testing at the Jetport at a cost of $25 per test by appointment, subject to availability. Maine's testing capacity is among the best in the nation. This capacity, which is 552% of Maine's testing target, according to the Global Health Institute, is made possible through partnerships, be it the IDEX Now testing agreement, our healthcare providers who've been swab and sends for these months, as well as the dedicated and hard work of our health and environmental testing lab. Maine has proven able to test at volume. All that said, more needs to be done to continue to identify and isolate people with COVID-19 as we try to tackle this pandemic. For a list of all sites providing tests to people without symptoms and without requiring a provider referral, visit the Keep Maine Healthy website. With that, I'll turn it back over to Dr. Shah for questions.
Great. Thank you, Commissioner. We will turn now to our colleagues in the media. And the first question for the afternoon goes to Steve Porter from Seacoast Media.
Thank you, Dr. Shah and Commissioner Lambrew. I wanted to ask a question about Ruby's in York. I understand from Maine CDC records that the restaurant has been dinged a couple of times now for failing to follow COVID-19 protocols. Does your team have a sense for whether the restaurant's conduct directly contributed to this outbreak? Can you comment on that?
Yeah, Steve, that's a question that we've been thinking through internally. At this stage of where we are in our outbreak, we can't draw a direct line between those two. Certainly, however, this is a reminder that the best practices and protocols that are set forth in the checklists and Governor Mills's executive orders are there and designed to prevent any types of transmission occurring within any kind of any kind of lodging or eating establishment. At this time, we've got to do more epidemiological investigation to try to make sure we can say one way or the other whether the compliance, or in this case, the non-compliance, may have contributed. We have to look at the timelines. We've got to do those things because what you're asking is a scientific question. But I think that this is a good reminder that these guidelines are not designed to be in the abstract. They are designed to keep people safe, and that is why we expect full compliance with them.
And have they been cooperative and forthcoming with the contact tracing process?
They have. Our investigators have been able to get a good sense of where employees may have been exposed, as well as anyone else who may have been at the facility during that time.
Great, thank you. And just one quick follow-up with Durgan Pines. We understand from the director of that facility that there may be more than 40 cases at this point. Do we expect that number to go up tomorrow? What can you tell us about that? Yes, we do expect that number to increase. The numbers that we have are, as is noted on our website, sort of as of late last night and very, very early into this morning. As the investigations continue throughout the day, we learn of and associate additional cases. Sadly, the outbreak at Durgan Pines is quite concerning, and we expect that there will be additional cases associated with it. Thank you. I'm going to turn next to Sarah Dedman at the Machias Valley News Observer.
Thank you, Dr. Shah and Commissioner Lambrew. The Washington County case count has increased a lot in the past 30 days, and testing locally remains an obstacle. There are whispers of a brief strike coming at Calais Regional Hospital, which is currently the county's only swab and send site. And we're still hearing from readers who simply cannot get themselves to either Ellsworth or Calais, both 1 hour from Machias, in order to be tested. As you know, we have a tremendous elderly population here, and there's all kinds of other obstacles. Commissioner Lambrew, late last month, you mentioned that you were working toward a way to help address testing needs in towns like Machias, and obviously you've made some strides, even just we heard about today. But do you have any updates on that goal that might help a rural town like ours?
Yeah, we do continue to work on every available option to provide testing on site at Machias. We don't want to prematurely announce what that would be until we are ready to go. All that said, we recognize the gap in the map. We are working to solve it. We also are closely following what's going on in Calais. We appreciate the fact that there could be some uncertainty about the testing volume that's happened at Calais Regional Hospital. It has, just for reference, really been producing significant volume of testing. We appreciate the partnership that we've had with Calais Regional Hospital in doing testing, as well as all of our swab and send sites. But we appreciate the gap. We are closely monitoring what's going on in Washington County, and we hope we have news to announce soon.
Great, thank you. And I have one other question, kind of a big one. Maine, as you know, hit its single-day high today with new cases. Are we nearing a point where the state considers going back into a lockdown?
So Dr. Shah can address this as well as I can. We, every single day, talk about what more we can be doing, what are different options, what are best ways to help protect people in Maine from the spread of COVID-19. We are in the throes of implementing the actions we announced last week, from lowering the indoor gathering limit from 100 to 50, to ensuring that people are wearing face coverings in public settings, defining what public settings are. For example, we're working now to figure out how we get the word out that if you do, for example, go to a restaurant, don't just wear a face covering going in and out of the restaurant. Wear it when you're sitting down, when you're not eating or drinking. Wear it when you're out for a walk, when you might run into people on the sidewalk. So using your common sense, but also recognizing that you're wearing that face covering can protect other people is important. We continue to look at activities like sports and announce some limits on Friday on sports, recognizing that there is, for moderate and higher risk sports, greater engagement, greater potential risk for spread. So we do continue to implement the recently announced policies to see if those policies will begin to make a difference. But every single day we look at what else we can be doing to better protect people in Maine, knowing that we all have the tools at our disposal as well. Following those basic public health precautions of keeping your hands clean, not touching your face, wearing the face covering, and keeping that 6 foot or more physical distance when possible.
Thank you.
Going to turn now to Steve at WMTW.
Doctor, you've heard the news from Pfizer this morning about a potential vaccine. Does this give you reason to be excited? Should we be excited?
Steve, here's my take on the data, and I've read as much of it as has been made public. That is to say, and I say that for a reason, we need to see all the data. We should not be conducting scientific policy through press releases. So I will be better able to speak about what this data and this announcement means once Pfizer has actually published all the data, and once it's gone through the peer review process, and once the expert scientists, the career scientists at the FDA have analyzed it and gone through it with a fine-tooth comb. Then I think we'll really be able to make pronouncements and projections about what this announcement really means. Based on what I've read, based on what was made publicly available, it's encouraging, but we need to see all of it. We've got to make sure that we all have insight into other data that might exist that wasn't put forth today. Once we've got that complete picture, then we'll be able to really analyze it. What was released was encouraging. It sounds favorable, but this is the beginning of the process, by no means the end of the analysis.
Thank you.
Gonna turn next to Hannah Deneen at News Center.
Hi there. Thank you for taking my questions. A few for you today. First, for both Dr. Shah and Director Lambrew, at this moment in time, as the cases of COVID-19 in Maine continue to rise, what are your biggest concern, or what is your biggest concern about the state of COVID in Maine?
I'll start, and then Commissioner, would love to get your thoughts as well. My biggest concern, Hannah, is unchecked community transmission. What has started to happen is that the ground in Maine has been seeded with a lot of COVID cases. And what I'm concerned about, as with any seeding, is that there will now start to be clumps, outbreaks that pop up across the state because of that low level, or now increasingly high level, of seeding. We've talked about some of the ways in which what we're contending with now is different from what we were contending with in March, April, and May. In keeping with that, one of the concerns I've got there is that when you combine this community transmission, this seeding, what can happen is that today's community transmission can become tomorrow's outbreaks. So my biggest fear is that today's community transmissions will soon start to become and snowball into tomorrow's outbreaks. The reason that this is a concern, among the obvious human toll it takes, is that the places in which these outbreaks arise may be different from the traditional places we've seen so far. So far, we've seen a number of outbreaks in places like congregate living settings. Going forward, given this seeding that has happened across the state, we are likely to see outbreaks in varied and different places: households, family gatherings, barbecues, places like that. Any type of place where people are together could be a place where we start to see outbreaks. To me, it's like a giant pot of water that you put to boil on the stove. I know that bubbles are going to start to come to the surface. I just don't know where, but we know they're going to happen. That's the biggest concern that I've got.
And I'll add that, well, as Dr. Shah said, there's some changes and new facets of COVID-19 this fall compared to the spring. we remain concerned about those people who are most vulnerable, people who live in nursing facilities, people who are in hospitals, people who are older, who have chronic illness. So we continue to work with our healthcare providers across the state to remind them of best practices for infection prevention and control, to make sure that they have the PPE and other supports that they need to keep themselves and their residents safe, and to try to make sure that we prevent the worst of what happens with COVID-19, which is severe illness and death.
Hannah,
Thank
just
you.
to round it out, the last thing that I'm concerned about is that the unacceptable racial and ethnic disparities that we have seen emerge could become exacerbated as we go into this next spike. We've talked at length about those disparities. We have, Commissioner Lambrew and I, as well as the governor, have called them what they are, which is flatly unacceptable. We've made strides with various organizations and groups to make sure we were doing everything we can. The other thing that I'm concerned about as we think about community spread is that those existing disparities could become even wider and wider.
Absolutely. And Dr. Shah, with what you said in mind about these new outbreaks being in homes, being in places that we haven't talked about at great length, or we have talked about, but we haven't seen up until this point, and people are planning for Thanksgiving. What are your plans for Thanksgiving?
I think this Thanksgiving for me and my immediate family will be a lot different. My family and I love to cook. It's what we do. It's what we spend our time on the weekends doing. That part of Thanksgiving is not going to change. But who is at our table is going to look a lot different this year than it has in previous years. For us, Thanksgiving has always been the one day of the year where we throw open our doors and invite everybody and their dog, literally everybody and their dog, to come to our house to spend time with us. This year, it's probably just going to be me and my immediate family and our dog. And that's sad. That's tough, but the world's different this year than it was last year. Let's hope that next year looks brighter.
Absolutely. And just quickly, a few of our viewers have messaged us. We're about 2 weeks out from a series of campaign events seen across the state of Maine. Have there been any outbreaks connected to those campaign events that we saw about 2 weeks ago?
Our case investigators, when they interview anyone who's tested positive for COVID, newly tested positive, we ask, among a slew of questions, we ask about any recent large gatherings they may have attended, because we're looking out for those types of associations. As of right now, we're continuing to look for any type of connection between any large gathering and an uptick in cases. As of right now, we haven't found anything concrete. We've seen some hints, but nothing concrete. So at this time, we don't really have more, but our investigators are continuing to investigate that. If we see any evidence of any association with any sort of gathering, we'll make sure we report that.
Thank you.
I'm going to turn now to Evan Popp.
Hi, Dr. Shah. Thank you. So you mentioned about the Pfizer vaccine needing more information before you could kind of definitively talk about that. But I'm wondering if that was eventually approved, it sounds like it will need constant and intense refrigeration. And can you describe how that process would work in Maine, and if the CDC and others are taking steps to increase cold storage and transportation capacity, and whether there's any concern that small hospitals or Mainers in rural areas might struggle to have access to the vaccine?
Sure. So Evan, let me first start by saying I can't predict what those data will look like, let alone whether the US FDA will authorize or approve the vaccine. That is an unknown. That being said, we're not waiting until that authorization or approval comes down the pike, if it does, in order to plan. We're planning right now for that possibility that the Pfizer vaccine may be approved or authorized. As you note, it does require ultra cold storage for storage. It can be taken out of storage for a number of days during the administration process. So it need not always be kept in ultra cold storage. It can, quote, survive outside of an ultra cold environment for a number of days on its journey toward its ultimate administration site. That being said, what we have been briefed upon by the US CDC is that the Pfizer vaccine is the type of vaccine where you want to bring the people to the vaccine rather than the vaccine to the people. So we are working to expand the scope of ultra cold storage that we've got in Maine. We've already talked to the various hospitals in Maine that have such facilities, and then we on our side are working to acquire additional freezers to bolster our internal capacity to store that vaccine. We've been working with the hospitals that say they not only have the storage, but also the space to accommodate positioning the vaccine if it were to be approved. There are concerns, as you noted, about rural areas of the state. So for that reason, we're working with a depot model where, again, given that the vaccine can exist outside of the ultra cold environment, where it can be brought to smaller hospitals if that's the route that those hospitals choose to go upon. There are other vaccines in the pipeline not too far behind the Pfizer one. So we're trying to make sure we can both accommodate the Pfizer vaccine at the places where it can be optimally controlled, as well as plan for the other vaccines. It is definitely a logistics challenge, but this is what we do at the Maine CDC and at DHHS. We take tough logistics challenges and we take them head on.
Thank you. Commissioner Lambrew, I was wondering if there was any update on federal money provided for vaccine distribution. I remember that you said in October that the state had received 800,000 and that there was concern about whether that was enough. Is there any more money coming from Washington, or are you expecting any to come in the future?
So we have a small update. Maine CDC heard last week that there would be additional money coming. We don't know how much money there is coming. All that said, Secretary Azar continues to make it clear that they are planning on funding most of the vaccine effort federally, directly to pharmacies, healthcare facilities. They issued a set of rules, emergency rules 2 weeks ago that required all types of health insurance to cover the cost of an individual getting the COVID-19 vaccine. They also created a new program for uninsured people who need the COVID-19 vaccine to get that vaccine for free. So at this point, the short answer is we have not seen additional money yet from the federal government beyond the 800,000. We may get some more given what we heard last week, but our understanding is that the federal government is planning to directly fund most of the vaccine effort directly.
Great. And then just one last question. I was hoping quickly, Dr. Shah, if you have any update on the Maine Correctional Center outbreak in Windham, if there's any latest numbers on that outbreak.
Sure. I can provide just the latest numbers, as you noted, for operational updates. I would refer you over to DOC. They'll have the latest on the ground there. At the Maine Correctional Center, there are a total now, as of this morning, of 131 total cases, 13 of which are among staff members and 118 of which are among residents.
Thank you.
I'm going to turn over to Isha at the BDN next.
Thank you, Dr. Shah. Can you hear me?
Sure enough, Isha.
Great, thanks. So I have two questions for either you or Commissioner Lambrew today. The first one is about college campuses. Are you concerned about cases spiking on college campuses, and also students will be leaving for Thanksgiving? So are you concerned that that might lead to further outbreaks both in Maine and across the country when students go home? And I'll let you answer that before I ask my second one.
Sure. Isha, we've continued to keep in close contact with colleges and universities and other higher education facilities across Maine. We've got a team or a liaison that works directly with them so that any needs and requests they've got, we can get answered and filtered up to the right folks. We are concerned with the latest increase in cases. They have occurred and I'm concerned not just for the numbers, but also the geographic spread. We've started to see cases in college campuses across the state, which up until very recently have not seen very many at all. The increase that we've seen, however, is consistent with the overall increase statewide. But that being said, anytime you're in an environment as kids are on college campuses where they're close together, there's the possibility of transmission. What concerns me specifically, Isha, are reports that our case investigators have relayed that some of the transmission events that we've seen on college campuses are related to parties. And so if you happen to be a college kid and you're watching this, I'm gonna ask again, you gotta do the right thing here. At a time like this with COVID all around, being at a party with your peers is not the right call. In fact, what we've seen from other college campuses, specifically in a paper that researchers in Wisconsin found, is that increases in cases on college campuses can then, in a matter of a few weeks, lead to more cases in other places in the town in which the college may be. So we've all got a chance here to keep a lid on things. For the college kids watching, I'm asking you to do the right thing.
Great, thank you. My second question is about restaurants. Are restaurants proving to be a concerning source of COVID-19 transmission? And are there contact tracing challenges associated with restaurants that are uniquely limited to restaurant contact tracing? Also, the second part of that question is, are you considering reinstating some of the restrictions on indoor dining apart from the ones that were included in the governor's mask mandate last week?
Sure, I'll talk about the epidemiological side, and then maybe the commissioner can talk about the policy issues there. Restaurants have been a concern, and certainly throughout. They just right now, for example, we've got 3 open outbreak investigations, at least 3, associated with eating establishments. I mentioned 2 today, the Portland Pie Company as well as Ruby's, and that comes on top of an outbreak at Pat's Pizza in the Old Port, which is increasing in size. So restaurants have been a source of transmission as well as a source of risk. Now, with respect to the challenges posed by contact tracing, one of the items that has been helpful has been the requirement under the checklists for restaurants to at least get the first name and phone number of parties who dine there. So we are able to touch base with restaurants and learn who may have been in proximity to any of the positive cases and alert them that they may have been exposed and enroll them in our contact tracing process. That has been helpful both from informing people of that they may have been exposed, as well as from a helping them monitor their symptoms perspective. But anytime you've got a diffuse group of people in a large room, figuring out who exactly constituted that close contact, 15 minutes within 6 feet, that's an added challenge.
And for all sectors of Maine's economy, there is guidance called COVID-19 prevention checklists that provide clear protocols, best practices for every type of establishment, including restaurants, to follow to keep their staff and their patrons safe. Again, we've just recently changed our guidance about public settings to increase the protections and decrease the gathering limits, which affect restaurants as well as other sites. We're going to do a close watch to see how those new protective measures work. But I do know that while we do believe that the key to a healthy economy is a healthy population, we also are respectful of the importance of many of the sectors of Maine's economy to keep going. So we will closely monitor the changes that we make to see if they're making a difference and take action as needed. But there's no announcements to announce today.
Thank you.
Isha, in case I didn't mention, the outbreak at Pat's Pizza stands at 32.
Thanks.
I'm going to turn next to Joe Lawler at the Press Herald.
Yes, hi. Just a super quick clarifying question for Commissioner Lambrew before my main questions. You mentioned at the Jetport $25 fee for rapid antigen tests. Can you explain why that's there's a fee for that, where the other antigen tests will be free in other places?
Sure. So we have 3 different types of tests. There's the traditional PCR test, the molecular test, which is the gold standard that we use here in Maine. We, through our state lab, our partnership with IDEX, and our relationship with the so-called swab and send sites, are using federal grant dollars that we have to support that effort. We also got from the federal government, or getting, I should say, up to 400,000 Binex Now tests, which are the rapid antigen tests, which have a fairly good, if not as good as the PCR test, predictive value, and Dr. Shah can talk in detail about that. We are through our arrangement with Walmart and other providers providing that at no cost to people. The third type of test, the Abbott Id Now test, we did get some support from the federal government for those tests, not as much support. Those tests are good for purposes like travel, which is why we supported at the York Hospital, where during the summer, many people drove back and forth between Maine and other states and got tests. We support that work at the Jetport, where, again, travelers are coming in and out. but because it's not quite as precise a test as the other two, we do think that it probably doesn't deserve as much state support.
Okay, got it. Thank you. And then I wanted to ask about the Pfizer vaccine and one other topic. If you could just, I'm trying to get a sense of the scope of the preparedness. So if you could explain, like, for instance, how many additional freezers that you'll need, how many doses you're expecting, and which hospitals will be distributing the vaccine if it's approved.
Sure. Joe, I would just go back to your earlier question, just really quickly for extreme clarity. The rapid test at the Jetport is not the antigen test, it's the ID Now, which is also rapid, but not an antigen test. Maybe too in the weeds, but just wanted to be crystal clear on that one. So with respect to the advanced preparation around the potential Pfizer vaccine, again, it requires -80 storage, a -80 ultra cold freezer, but not for the entire duration. Again, it can be taken out and survive out of the -80 environment for a number of days as it's being taken on its way for administration. Early on in our vaccine planning process, we worked with hospitals and healthcare facilities to do a complete inventory of what their vaccine assets were. And based on that inventory, we were able to identify 5 hospitals in the state that possessed ultra cold storage. I'll get you the full list, Joe, but it's everywhere from A.R. Gould, CMMC, MMC, EMMC, et cetera. They all have ultra cold storage capacities. One of the challenges with the Pfizer vaccine, however, is that it will come in lots of 975 doses. So now we have an additional question, not just whether you've got an ultra cold freezer, but how much space do you have in that freezer? So where we are with the hospitals right now is going to ground on that second level question. How much physical space do you have, and how much additional vaccine can you accommodate in your current freezer? How much can you free up, so on and so forth? For what hospitals do not have space for, we will plan to hold in a depot fashion at our public health warehouse. For that process, we are going to acquire at least 1, potentially 2 ultra cold freezers for that purpose. There is a shortage on those freezers, but thanks to the ingenuity of the Maine CDC Public Health Emergency Preparedness Team, we've been working with vendors who have some of them in stock. So we're working to acquire at least 1, perhaps 2, so that we can be the secondary intermediate depot while the hospitals are working to administer it on their side. Does that answer your questions?
Yes, thank you.
Mm-hmm.
And then just
sorry, Joe. Let me just, the commissioner wanted to weigh in as well.
Well, I do want to go back and correct myself, Joe. So the Binax Now test, we're working in partnership with Walgreens to deliver that test. So I just want to make sure that that was clear. I misspoke.
Okay, thank you. Yes, so yeah, just a couple more little things. I know Moderna is possibly, and could be the next one after Pfizer approved. Is that the same type of deep freeze storage that you would need for Moderna as for Pfizer? And then my last question is just simply, with the increase in cases, is there any thought about doing surveillance testing for hospital healthcare workers? Thank you.
Sure. So Joe, on the vaccine front, first, let me kind of just tie up on the Pfizer vaccine. Because of these unique storage requirements, it has been the opinion of the US CDC that this vaccine will be optimum for healthcare workers and first responders. As I mentioned a moment ago, this is the sort of vaccine where you bring people to the vaccine rather than necessarily bringing the vaccine to people. Even though it can, quote, survive outside of that deep freeze for some period of time, it really is one, based on what we've been instructed so far, it's really one where, because of that nature, it will probably be one that's best for hospitals. So that's the way we are approaching that planning right now, and working with the hospitals to query their ultra cold storage capacity. The Moderna vaccine which is also working its way through its final stages of clinical trials, at this time will not require that deep ultra cold storage. It will require storage between -2 and -8 centigrade, not -80 centigrade. So that will open up the doors for broader applications. Whereas the Pfizer one may be one where we bring people to it and limit it, not limit it, but make it ideal for healthcare workers. The Moderna vaccine may be one that has broader applications, perhaps for nursing homes and other congregate living settings, as well as for applications just in the community as a whole. So again, these logistics really do drive how we think about who might be optimally suited for the vaccine, as well as the clinical data, which, as I mentioned a moment ago, we haven't seen yet. So we've got to put all of these factors into our planning as we think about which vaccine should go where and for whom. And with respect to surveillance testing, Joe, different hospitals are undertaking different protocols for surveillance testing. We do require surveillance testing to be done for employees of long-term care and other congregate living settings. And that is on a schedule that is set forth in partnership with federal CMS based on the level of transmission that's occurring in the county in which the facility is located. Now that is already required. It's been ongoing for a while. And as I've reported, we've actually detected cases and potentially prevented outbreaks as a result of that proactive surveillance testing.
My question was about hospitals.
Yep, hospitals are taking different strategies. Some hospitals are offering it to their employees, to their symptomatic employees. At this time, we haven't moved forward with that same degree of surveillance testing at the hospital level. We've really focused on long-term care and other nursing facilities because of the unique vulnerable state of the residents there. Whereas at hospitals, the contact may be a bit more transient. There's also greater access to PPE. So for that reason, we haven't moved in on hospitals yet. It's notable that, and I think we talked about this last week, transmission at the hospital level from staff member to employee has thankfully been the rare occurrence, not the norm. And again, I think that's because of the nature of hospital work and the greater availability of PPE. So that's where we are right now. Nothing is off the table. And certainly if we start seeing increases, we'll have to start working with the hospitals more to detect cases. I'm going to turn now to Amy Brown at WERU.
Thank you, Dr. Shah. I have a couple of questions from listeners, and I think these could go to either one of you. The first is a listener from Waldo County says that they tried to reach out to police for help recently after initially trying to go into a store to shop and then later trying to use a public outdoor space, and in both places finding a large number of people not wearing masks and not observing distancing. They were told by the police to call 211. And actually they said that when they tried calling 211, it said it was out of service. I've tried it since, it's working fine now, but they asked what, so I don't know what 211 would have told them, but they asked us to ask you all what they should do in that kind of situation and whether or not it's true that police are not able to step in. And that's just one of another. I have another.
So I'll begin by saying we have, through the Keep Maine Healthy grant program, provided up to $13 million to municipal governments to help them with education and enforcement efforts. Every city and every town is a little bit different in terms of how they approach different types of public health activities. We do think that they're typically partners with us. So in most places, there is a partner in the local health officer, local law enforcement who help us with this. But we also do think that the more we can use education about the importance of this is partly going to be, the spread will partly be stopped through enforcement efforts, but mostly we believe by trying to continue to educate people, to provide them with the information, the tools, and the other kind of bigger measures like gathering limits. Because as Dr. Shah has previously said, we do know that there are some settings that are harder to slow the spread of COVID-19 in, and that does include large gatherings.
So is there something she should have done in that situation differently? I mean, she's obviously not going to be able to provide education to all of those folks, but they're asking for concrete advice. If they
I
want to
mean,
go
there's-
shopping and they don't feel like it's safe.
I think typically in large retail stores, they are subject to the enforcement requirement. Talking to the store manager is one option. I do believe what she already tried, which is talking to local law enforcement, is an option. We do have a portal where any individual in Maine can submit a complaint about the lack of a protocol in a public setting. That is something we talked about previously. And so we recommend all of the above for people who are interested in reporting concerns.
Yeah, she's another one who brought up the issue of that's not anonymous. And so she was afraid to make a complaint, small town. We did talk about that, I believe, on Friday. You commented on looking into getting an anonymous kind of reporting situation set up.
Sure, and let me just speak to that for 1 minute, which is, we do have limits on what we can do here in state government. There's public access rules that most reporters are very familiar with about providing information that people submit to state government, and we just can't be exempted from that. All that said, we do have workplace whistleblower laws, for example, so employees do have certain protections when it comes to workplace safety. There are other different avenues for people in settings that they can't avoid, like workplaces, to report things. So while we don't at this point have an anonymous system, and that's partly because there have been concerns raised, will there be a competitor continually submitting anonymous complaints about their other actor on the block as a means to try to get them to have a competitive advantage? We know that there's some challenges with anonymous complaint lines, which is why I think we have continued to hope that working with our local communities about the importance of public health is the best way to go.
Okay, the second question was from a listener who wonders if you have any advice for people who are in blended families where kids are shuttling back and forth between different homes, there are different schools involved, and people are not being consistent with following protocols, safety protocols.
I think, Amy, the best thing there is that the advice that we've now learned that is the most effective at this stage of COVID is that the basics, like wearing a face covering, maintaining distance, good, proper hand washing, those are the best tools, regardless of the composition or structure of a family. Now, of course, it's harder when there are differing rules in one household and another. But those basics, like wearing a face covering, even as we are going all indoors, trying to keep distance, and making sure we're good with washing our hands, those basics still apply, I think, regardless and across multiple situations.
Okay, and one more, some municipalities are testing wastewater for COVID. College campuses in the state have been doing that. Do you know how many are, and is that being tracked by the CDC?
We're aware of a number. I'd have to check with our environmental health program, who keeps in touch with those municipalities. We are aware of quite a few across the state, and we can check and see what the latest number is. They're not required to report those to us, but we do offer to work with them to provide technical assistance and best practices and tips on how to interpret the data, with the challenge being what to do next after it's detected.
All right, thank you.
Before I turn to the next question, I want to go back to Joe Lawler. Joe, I wanted to correct the record on something that I said. I told you, I think erroneously, that the Moderna vaccine required storage between -2 and -8. That was incorrect. The Moderna vaccine requires storage at -20. I was just looking at my notes there and realized I misspoke. So I wanted to correct the record there ASAP. I'm going to turn now to Brian Sullivan at WABI.
Thank you, Dr. Shah. I have a question about college system, specifically the University of Maine system. The latest numbers from UMaine, I think, say there are 33 cases, and I believe 13 come from their facilities management office on the Orono campus. But we haven't heard that listed as an outbreak during these briefings. Is there a difference in the way that the UMS reportings go along with the Maine CDC reportings, and why that hasn't been listed as an outbreak?
No, it's not so much that there's a difference. We're just trying to sort out whether, as with all work setting outbreaks, whether there was transmission that may have occurred there or whether it was incidentally detected there. So that's the principal reason there. But in addition to that, for matters involving UMaine, they would have better insight into where they are in terms of the case numbers. From the outbreak perspective, We're always just trying to sort out whether transmission may have occurred at that location. It was just detected there.
Okay. We did speak with UMaine today, and those were the numbers that they gave us. So, do you not consider that an outbreak on the Orono campus right now?
No, I would have to check with our epidemiology team to see if we've opened an investigation. Generally, the outbreaks that I comment on here are ones where there's not a spokesperson associated with the facility, or somewhere where there is a healthcare facility involved, where loved ones may be at risk, or a place of general common access like a restaurant. Those are the ones that I tend to focus on. If I haven't mentioned it, it's not to suggest that nothing is going on. It's just that I want to make sure I'm spending my time talking to folks about the ones that we know are potentially places that might affect people.
Understood. That makes sense.
Mm-hmm.
And I have a question about the island of North Haven. We've talked to some people there, and when COVID-19 does make its way to an island, I guess specific sets of dangers or advice for the people on an island when there is the illness present there.
Sure. Commissioner Lambrew and I have been briefed on this situation and have been in touch with folks who are involved. We've been concerned about this situation, about situations of this nature that could manifest in island communities. That's one reason, actually, last week, as we were thinking about distributions of the Binax Now, this rapid antigen kit, we made sure we put a focus on communities where we needed to get testing answers because of their somewhat more remote nature, as well as the fact that there's more interconnectedness and more opportunities to spread. So I think, Brian, that kind of points a light toward what I would recommend as best practices for island communities, which is to say, making sure that the things that make island life really great, which is that deep connection with your neighbors, don't accidentally generate transmission. That's the concern we're facing right now. When I talk about household transmission, community level transmission, it's occurring on the islands. It can occur on the islands just as much as it can occur on the mainland. And I think we're starting to see that on North Haven.
Thank you.
I'm going to turn now to Patty White at Maine Public.
Thanks, Dr. Shah. I've got a question about the new swab and send sites. Obviously, it's good news to have more testing, but what's that going to do for the turnaround time for results and also the follow-up from case investigators and contact tracers? Is that going to create any delays, especially with the increase in daily cases?
So I'll go ahead. I'll go ahead and start, and then Commissioner can chime in on top of that. The bottom line, Patty, is that the primary goal here, the prime directive, is to offer and expand the amount of testing that we can across the state, to especially places like in Androscoggin County, where we've heard from community members that more testing is needed. But similarly, we recognize that may place additional demands on our epidemiology and our lab staff. So we're continuing to turn up the dial to make sure that we've got the staff necessary to respond when we see positive test results. We are continuing to make sure that we can redeploy staff from within Maine CDC to serve as case investigators, as well soon as contact tracers. We're simultaneously starting new and more frequent training classes to train more individuals in case investigation and contact tracing. We've got to make sure we can expand testing. If that means getting more staff to turn up the dial on case investigation, that's what we'll do.
And I know you gave an update on some of those numbers for how much you're trying to increase last week. Are those numbers the same or have those changed?
They are largely the same as what we talked about last week, which is to say, starting this morning, approximately 25 individuals within Maine CDC who were previously trained to be case investigators have redeployed. And that's as of this morning. We are simultaneously working with other groups to tap into resources across state government to train more case investigators and contact tracers. We're also working to streamline the process to see if there are quality improvements that we can make, say, for example, in the reports that come into us in paper format, trying to see if there are ways that we can make all of that more and more electronic to be a lot more efficient in the way that we investigate cases.
Okay, thanks. And then if I could just ask about the outbreaks at the nursing homes, Russell Park and Durgan Pines, What can you tell us about how those outbreaks started? I mean, typically in the past it's been through, it comes in through staff, but can you tell us anything else? Did it start at a household gathering that a staff member was at and bring it in, or what else can you tell us about how those started?
So, we had a really detailed and productive call. I'll focus on Russell Park. We had a very detailed and productive call with the leadership at Russell Park, particularly their administrator, who has really been on top of this. In this situation, based on what we understand in Russell Park, the first symptomatic individual, based on where we are in our investigation right now, the first symptomatic individual was in fact a resident. But as we know from nursing facilities, and as you hinted at, Patty, it's typically brought in by staff for the most part. We haven't identified yet specifically which staff member may have been the first to introduce it. We're not aware of reports of staff members who were symptomatic, but of course we know now that much of the transmission can occur before folks have symptoms. We're trying to identify who or which set of staff members may have been among the first to introduce it into Russell Park. And then we'll be able to go back in time with them to determine whether they acquired it, say, at a family gathering, so on and so forth. We've just opened the investigation just in the recent days, so we haven't figured that layer out yet, but that's where we're looking into. But Patty, the other thing that we have seen now in multiple occasions at healthcare facility outbreaks is related to where within the facility the transmission may have occurred. And I want to say this really delicately because it's a sensitive topic. And I want to preface what I'm about to say by acknowledging that healthcare workers across the country and across the state have been working tireless, countless hours since the beginning of the pandemic under extremely difficult conditions in a world that has been turned upside down. That being said, we have identified in certain facility outbreaks some concerns that while employees are in break rooms or are working outside when they're not in direct patient care, they may have let their guard down a little bit. It's human nature. We've been conditioned so far in the pandemic to focus on times when we're interacting with patients, with residents, and that's when we've got our PPE guard up. But that maybe when we're with our colleagues, we let it down a little bit. So if you're a healthcare worker who's watching right now, I hear you. I understand how difficult the conditions you've been working under are. My ask to you today is that you keep your PPE guard up even when you're not working with a direct patient. When you are in the break room or when you're on your lunch break, stay 6 feet apart, keep your mask on and your N95 on as much as you can. We know you've got to eat lunch, try to do so alone. Those are the best ways to keep our guard up and limit transmission.
Thanks.
I'm going to turn now to Brad Rogers at GME.
Hey, we've seen a rise in hospitalizations in Augusta, and now perhaps it will happen in Lewiston and Portland as well. What feedback are you getting from hospitals, doctors, and nurses? How concerned are they with this spike? We went 4 months with relatively low numbers, and now all of a sudden they shot way back up.
Brad, I'll speak for myself only in what I've learned from providers and obviously let Commissioner Lambrew weigh in as well. I had the opportunity just over the weekend to check in with colleagues of mine who are healthcare providers and physicians across the state, and they expressed significant concern both about what they've been seeing in their own patients as well as what they've been seeing in their facilities. From their patient perspective, they're worried because the people who get hospitalized in Maine are often those who already have pre-existing health conditions. So from just a human perspective, the increase in hospitalizations presents challenges for any healthcare provider. But from a facilities perspective, they want to make sure that we don't enter a situation that other states, say like Wisconsin and South Dakota, have started to experience, which is shortages around those vital facilities. We haven't seen those in Maine, and we think we're far off from having shortages of beds. But we've got to take steps right now because there's a time in the period of every single hospital that is experiencing a shortage in beds where they weren't experiencing a shortage in beds. Now is the time for all of us in Maine to take steps so we don't get to that place. Commissioner?
And we had done this in the spring. We continued it over the summer, and we are doubling down to make sure that we have sufficient PPE, that we've looked at our testing supplies to make sure that they're sufficient, that we have alternative care site models ready to go, that we have projections that are aligned. So we have increased our pace of engagement to ensure that we maintain sufficient capacity for treating people in hospitals and other sites of care, because we are committed to making sure that we not only prevent the spread of COVID-19, that we treat those who get it as well.
Thank you both.
And the final question for the afternoon goes to Patrick Whittle from the AP.
Thank you very much. Wanted to piggyback on an earlier question and ask if it's possible that stay at home or stay healthy at home orders could possibly resurface. It sounds like what I'm hearing is that it's being considered and it's a possibility, but nothing is imminent. And also, Joe Biden has said a few times that as president, he would be interested in doing a nationwide mask mandate. Curious if the DHHS or governor's office or Maine CDC has a position on that.
So to start out with, we always look at all options, look back on what worked in the spring and the summer, what other states are contemplating. So as Dr. Shah said, nothing is off the table, but there are no actions or changes to announce today. We will continue to keep people apprised. Our goal is to keep public health as our North Star, but to allow people to engage on those essential functions and important functions as possible, so long as it doesn't interfere with our goal of preventing the spread of COVID-19. Going to the potential for a national requirement for face coverings, I can't imagine that there is a requirement that will come that's different than what we have here in Maine. I think the governor has decided early on in gradual stages to begin to target face coverings to settings and places, and to make sure that we've learned from those settings what works best. Just again last week with our definition of what is a public setting and eliminating the exemption when there can be physical distancing in a public setting. Those are best practices that we've seen in different places, and we're quite comfortable that whatever might come from a national policy would be consistent with what we have here in Maine.
Thanks, Patrick. Before we close for the afternoon, I would just like to mention a few things. The first is that we have started the process of moving these briefings back to a Monday, Wednesday, Friday schedule to increase and make sure that everyone is aware of where things stand with COVID. Given the increases in cases, hospitalizations, positivity rates, as well as additional activity on the national front, we want to make sure that everyone in Maine has full visibility and transparency into where things stand right now. So as we move back to that Monday, Wednesday, Friday schedule, we'll be adding more briefings. Normally, the next briefing would be on Wednesday. However, in honor of Veterans Day, we will be holding a briefing not on Wednesday of this week, but on Thursday of this week, not on Wednesday. And so, since we will not be reconvening as a group until after Veterans Day, I wanted to close today by thanking each and every veteran, as well as their families, for their incredible service to our country. We'd like to take a moment to honor the sacrifices that all of you have made for the common good of our state and for our country. So with that, we thank you for joining us this afternoon. As always, do the right thing, wear a mask, be kind, take care of one another, and we'll talk again on Thursday.